Good afternoon and welcome to the second in a series of 3 webinars on air pollution and health in Southeast Europe. My name is Eliane Van Vliet and I'm a staff scientist at the Health Effects Institute. Today's webinar is in partnership with the Europe chapter of the International Society for Environmental Epidemiology, or ISEE. The ISEE-Europe chapter was started in 2002 to promote contact between and action by European members of ISEE on matters related to environmental health research, education in environmental epidemiology, and the improvement of public health in Europe. As some of you know, the Health Effects Institute, or HEI, works on air pollution and health in the US and globally. We focus on answering questions related to health effects of air pollution with a view to inform policy. And this has resulted in over 300 studies focused on a variety of questions related to exposure, related to health effects, and also health impacts of air pollution in countries around the world. We also spend time synthesizing and reviewing the evidence to understand the current knowledge and information. And in fact, we have a major review of literature of traffic-related air pollution and its health effects coming out early next year. Within the Institute, we also have a global health program focused on the synthesis of available evidence, access to data on air quality and health for countries around the world, and technical support and capacity building. Earlier this year, we launched a project in Southeast Europe with support from the Clean Air Fund with the goal of reviewing and summarizing the available evidence on air quality trends, the sources of air pollution, health effects, and potential health burden in the region. And we're also focusing on Bulgaria and Serbia as specific examples. With the help of our regional collaborators, we'll be publishing 3 reports early next year. And in these reports, we aim to provide an overview of the status and trends of air pollutants, the associated health burden on citizens in the region, both overall and specifically in Serbia and Bulgaria. And within this project, we're looking to build local connections and networks among a variety of groups, including scientists, physicians, and civil society groups. This webinar today, the 3 series are among our efforts to continue some of the conversations on the air pollution and health related topics following our virtual workshop that was held this past June. So as part of this project, we're also developing an interactive literature database. This will be geographically organized, and we hope it will contain all the air pollution and health relevant research articles and papers from the region to help inform researchers, the public, and policymakers. So before the official launch of the database in early February of next year, we invite you to share any relevant publications with us so that we can ensure the completeness of the database. So you can email us at the address provided on this slide here, see@healtheffects.org. Now, before we delve into today's webinar, just a few housekeeping announcements. All attendees will be muted and in view-only mode for the duration of the webinar. There will be a 30-minute discussion and Q&A session at the end of the webinar. And please, we invite you to submit your questions as well as upvote any questions using the Q&A function on your Zoom. And you can do that at any time during the webinar and during the Q&A. And if you experience any logistical difficulties, please contact us using the chat box. The webinar slides and recordings will be available in the coming weeks, so please check back on our website for those. And you can find our previous webinar slides and recording already posted there. And if you plan to post about the webinars on social media today, please use the hashtag listed here, SEEAQ 2021. And to help improve our future webinars, we'd be grateful if you could complete the post-workshop, or webinar rather, survey that will be emailed to you tomorrow. So today we are very excited. We have a very interesting webinar for you today with an esteemed group of speakers who will discuss the status of air quality and health data streams and their accessibility and usability across Southeast Europe. And to moderate today's session, it's my honor to introduce today's chairs, Dr. Dragan Gjorgjev, who's a professor of environment and health in the medical faculty at the University SS Cyril and Methodius in Skopje, Republic of North Macedonia, as well as policy advisor to the National Institute of Public Health. The main focus of his research is on conducting health impact assessments of environment health hazards, especially ambient air pollution and climate change. And our co-chair is Dr. Hanna, who has more than 15 years of experience in air pollution epidemiology. She is a consultant principal scientist at the Health Effects Institute and is currently based in Europe. She has been the advisor of the World Health Organization, National Institute of Environmental Health Sciences, Health Canada, and other national and international bodies. Dr. Boogaard is also associate editor for the scientific journal Environment International, and she's co-chair of ISEE-Europe chapter and also serves on their policy committee. So we will start today's webinar with short opening remarks from our co-chairs. Then we are going to turn to research being conducted in Bulgaria to leverage ground monitoring, satellite, and modeling data to fill gaps in air quality data. We will then hear about the availability of local air quality data in Bosnia and Herzegovina. And finally, we'll learn about a case study from Serbia, where survey data are used to analyze the association between exposure to air pollution and health effects. I will now give the floor to Dr. Hanna Boogaard first, and then to Dr. Dragan Gjorgjev to share some opening remarks and lead us into the webinar. Thank you. Hanna, to you.
Thank you, Eliana. Do you hear me okay?
Yes.
Okay, super. So welcome everybody. I'm very excited to have this webinar here today, and a big thanks to the various organizers. So before we jump into the talks, I would like to emphasize three things. First, the burden of air pollution. The burden of disease due to air pollution is large across the globe. It's large in Europe, and it's also large in Southeast Europe. Secondly, there's an overwhelming body of evidence that has accumulated in the last 2 decades, demonstrating that the health effects of air pollution are serious and that they can affect nearly all organ systems in the human body. And thirdly, there is no safe level of air pollution, and everybody is exposed. HEI just released a large study in Europe. It's called the ELAPSE study, investigating the health effects of low levels of air pollution. And when I say low levels of air pollution, I mean below the EU limit values. This report analyzed 22 cohorts from 11 countries across Europe. This really an unprecedented effort. And please check our HEI website for this report. We can also put a link to the HEI report in the chat later. So really both the Health Effects Institute and the International Society for Environmental Epidemiology in Europe, they recognize the importance to foster environmental health research in this region and beyond. So the current webinar is really part of a wider engagement. So for example, ISEE-Europe has held a first networking event last June with many of you in the region to really increase collaborations and to provide opportunities for discussions, actions, and really ideas to foster environmental health research. So ISEE-Europe is also planning other events in this regard, so really please stay tuned and please get in touch if you want to contribute to this going forward. So I'm very much looking forward to this webinar. I stop here and give the floor to my co-chair, Dragan. Dragan, please.
Yes, Hanna, thank you very much. I hope you hear me.
Yes.
It is also my pleasure that I'm chairing such an important event as this is today, and I also am very much grateful to the Health Institute and also to the ICE on the organization and on the keep pushing us to make this a network of the institutions in the region vivid. And this is, as we know, the second, and there will be more webinars, and I hope that all the attendees are very much looking for each of these events, because let's say for today we have a brilliant 3 presentations for different aspects of the need of the data, what we have in the process of assessing the impact to the human health. And I would just emphasize the 2 very much important aspects of this process. One is that we are just evaluating the success of the policies what are currently present in the region regarding the air pollution and health effects. And this is a very objective evaluation when we use the right data in this process. And then we also can present to the public, especially to the political people, what will be the advantages if we follow if we have an efficient policies, and if we decrease the level of pollution what currently we have in the country. So these are very exciting roles what we have in this moment, even though maybe we are not on the top of the political agenda. Maybe one of the handicaps is that all of these processes are very much depending on the political will to put them top on the agenda. But nevertheless, the research community is very active, and we can see even today that we are producing a very important data from different aspects, which are important in the whole process. So again, to repeat, I'm very much excited to run the discussion together with Hanna, and I will just now start with the first speaker. This is my colleague from Bulgaria, Professor Annette Dimitrova. She is an associate professor at Sofia University, St. Clement Ohridsky, Faculty of Physics and the Department of Meteorology and Geophysics in Bulgaria. And she has extensive experience in numerical modeling of atmospheric dynamics, transport and diffusion of air pollution at regional and local scales, as well as assessing the relation of outdoor pollution to human health. Dr. Dimitrova has participated in numerous long-term national, regional, and international research projects. Knowing myself the high importance of the modeling in the whole process of air quality management, I'm also very much excited to hear this presentation and to see it. And please, Professor Dimitrova, you have the floor in the next 15 minutes.
Thank you, Dragan. I will share my screen now. Oh, sorry. It is my pleasure to talk today about some issues of the role of modeling and forecasting in providing some useful data to try to answer mainly the question, can we really combine all available data to improve the air quality study? The motivation of my talk is obvious. As unfortunately Bulgaria has the highest rate of premature deaths due to air pollution in Europe, the diagram on the left side presents the lost years of healthy life, and Bulgaria is on the first place with 2.5 lost years of healthy life, which is more in comparison with countries like China and India. More recent study investigate the links between urban blue spaces, climate and health. The data presented on this right slide came from study published in the Lancet Planetary Health in January 2021. This air pollution ranking includes 1,000 European cities. The city ranked #1 has the worst mortality data related to air pollution. The avoidable deaths can be interpreted as the number of deaths that could be prevented each year if exposure to air pollution were reduced. In the case of the World Health Organization recommendation in these two columns, or almost eliminated in the case of the lowest measured level. The capital of Bulgaria, Sofia, is within the first 100 polluted cities in Europe. It is notable that more than half of the world population lives in urban areas. Cities are becoming centers of human activity because people expect to improve the quality of life. But we also know that large urban regions, on the other hand, are the largest sources of greenhouse gases and air pollutants and cause changes in the land cover. The urban environment is the most complicated and complex system. The figure on the right outlines typical flow patterns and processes encountered in urban areas. Their flow in complex terrain is dominated by regional scales, but interacted with global and local scales. The urban development has significant environmental impacts related to landscape changes, urban biosphere, and modification of the flow regime. The urban system is very difficult to be modeled due to complicated interactions between different scales and phenomena. The National Air Quality Data Network is managed by Bulgarian Executive Environmental Agency, and data are provided to the European Environmental Agency. These data are used for air quality index calculation presented on these real-time maps. Sofia has 5 automatic and 1 manual sampling measuring stations. Only 2-3 in other big cities like Plovdiv, Varna, and Burgas are available. The lack of ground air quality data make air pollution studies not reliable only on this source. During the last years, additional 22 measuring sensor stations were installed in Sofia, and also a dense civil network of low-cost sensors called AirBG. They provide additional data on PM concentration with maps or plots in real time, but this data still need verification and calibration and have to be used in caution. Here are presented some examples of these maps. Satellite data provide valuable information on topography, land cover, meteorological variables, and air pollution. Over the last decade, satellite data have been used widely to track pollution from agriculture and wildfires. 2 big centers collected and process information and provide useful products like maps and data. A lot of data are available, but different temporal and spatial resolution coming from different satellites, missing periods based on satellite orbit and cloud cover. Also, a lot of uncertainty with data retrieval for the lower troposphere. The remote sensing technologies provide concentration of the main pollutants in the entire column of the atmosphere, and also provide aerosol optic of depth, which can used to retrieve the particulate matter 2.5. Data access is also a common barrier to data use because of the increasingly large number of data types, metadata, the websites for finding data, and also which can be, the first-time user have difficulties to find and use this data. Numerical modeling is a very useful tool for air quality studies. But the main difficulty is that we have to use different type of models to describe different scales, as various physical phenomena are responsible for air pollution at each scale. Once released, air pollutants becomes part of airflow. Air quality is relevant to many scales, which are dictated by the average time before removal and its effects on health and ecosystem. At micro and local or city scales, air pollution is characterized by primary pollutant from combustion mainly, with considerable small-scale variability due to the specifics of the emission sources, integrating with the complex wind field and different meteorological conditions. At the regional and global scales, long-living species such as greenhouse gases have residence times of years to centuries. Since emissions exceed rates of removal, this can steadily increase global background concentration of certain gases. They are actively changing radiative forcing for the planet, a major cause of anthropogenic climate change. Data assimilation is a technique that provides the best estimate of the state of a physical system by combining modeling and observations. All described here data can be assimilated. The forcing data used to run numerical model. The model output is compared with the simulated data and provides some information on model errors. After that, this error minimized by specific technology. The technique is used in the global weather forecasts, and only 2 big centers described here are authorized to provide such forecast. Here you can see one example of 2-meter temperature and 30 meters wind from this type of forecast with data assimilated. Bulgaria has decades of tradition in regional scale air quality modeling. Today we have a Bulgarian chemical weather forecast system providing forecasts over 5 domains from Europe to Skopje region with 1 kilometer resolution. The system presents online 72 hours forecasts for concentration of main pollutants and for also air quality index calculated using the modeling data. The system is based on well-known models like weather research and forecasting model, which provide a meteorological input to the system. Also, the sparse matrix operator kernel emission model with many modifications regarding Bulgarian national emission inventory. And finally, the community multi-scale air quality model supported by US Environmental Protection Agency. Large urban areas and Sofia particularly has problem with air quality, mainly high levels of particulate matter. An example of high resolution with 50 meters local scale modeling using the atmospheric dispersion modeling system is shown here. The contribution of main sources to the annual mean concentration over the entire domain for PM are shown. More than 50% are coming from the domestic heating over the Sofia region. Some special distribution maps of the contribution of different sources of PM10 during the cold season are shown on the right side. The domestic heating, you can see here, is mainly due to the satellite villages around Sofia city and some residential areas. In the central part of the city, most of the households use alternative ways such as central gas heating or electricity, and the contribution of this source is negligible. Transport is absolutely dominant source of PM10 pollution in the central city area and along the roads with heavy traffic. The contribution of this source is more than 80%, as we can see from the scale. Another source with significant influence in the city area is the unorganized transport from residential areas, where the impact is more than 50%. Air quality modeling has significant challenges, but also some advantages. The most uncertainties in modeling due to the made assumptions, lack of data required as input for the model, and the emission inventory. As was shown on the previous slide, the domestic heating as well as the transport have the most significant impact on the air quality. The emission inventory needs improvement for these sources. Different spatial and temporal scales of the phenomena and interaction between scales require proper background concentration to be added. Complicated chemistry with hundreds of reactions are responsible for the secondary formed pollutants. In spite of these challenges, air quality modeling has a lot of advantages. The modeling can provide continuous in space and time concentration fields and forecasts over the selected area. Also, modeling can be used for estimation of the contribution of each source type to the concentration field, simulation of different scenarios for future emission reduction, and ensure helpful information for the authorities. One way to improve the air quality modeling is to combine the complementary advantages of complex chemistry mechanism coming from the regional models, like CMAC here, which can operate over long spatial and temporal scales and use like a background concentration, with the better presentation of fine scale concentration gradients from explicitly defined sources in the tau, using complicated emission models and combining with local scale modeling. Here I want to share some of the—
Sorry, Renata, sorry, can you just wrap up in a couple of minutes? Sorry for the time limit.
Yeah, I'm
Thank you.
finishing. I have 2 more slides.
Thank you, thank you, thank you.
Here I want to share some of the ongoing programs and projects in Bulgaria in which I'm personally involved. The working package quality of life in Bulgaria, which is part of the National Science Program. Another project, development of a methodology for air quality and human health risk assessment in urban areas, just funded by the National Science Fund, and it is focused on all discussed here problems. And the Big Data for Smart Society Institute, GATE, is a purpose-built institute established in 2019 as an autonomous structure of Sofia University, focused on 4 main areas like data management, data analysis, data insights, and data engineering. And to finish here, I pointed our future activities related to all discussed challenges, like lack of data and missing studies. All these activities are involved in the new project. We plan to improve the emission inventory for domestic heating and transportation by more precise description of metadata, by additional sources and software tools. Also, we plan air quality modeling to be performed using the automated system for nesting the high resolution local air quality model in the regional air quality model. Additional data will be collected at 2 new station purpose within the project. And finally, we plan to conduct a bespoke epidemiological study with representative samples of citizens of Sofia, and also to model different future scenarios to help city planners solving specific tasks like alternative situations. Thank you very much for your attention.
Thank you very much, Professor Dimitrova. And I have here 1 or 2 questions, but I will ask the colleagues just to keep them for the question and answer session, because we are a little bit running of time. So there are some interesting questions for you. So now I will leave the floor to Hanna to introduce the next speaker. Please, Hanna.
Sure. Thank you, Renata, for this great presentation. Very interesting. I'm sure there will be a lot of questions for you later. So for now, let me introduce our next speaker, Katja Jezepina. Sorry if I pronounced that not correct. So she is assistant professor at the Center for Atmospheric Research of the University of Nova Gorica in Slovenia. Her scientific research is in the field of atmospheric chemistry, with a focus on the chemical characterization of ambient aerosols in the urban and remote environments through integrating measurements and modeling. And we're really looking forward to your presentations on measurements. Go ahead, Katja. Are you there, Katja? No, I don't hear you. You're in and out, Katja.
Okay, Hanna, we will go to the next speaker and come back to Katja as soon as we resolve the audio issues.
Here.
Absolutely, yes.
Katja, we will come back to you. We are having a hard time hearing you. So we will give the floor to Dragan to introduce next speaker. Thank you.
Yes, okay. So I hope it will be resolved because really Katja has a very interesting presentation. But also I'm excited to hear the presentation of Dr. Nataša Dragic. She is an assistant professor and specialist of hygiene in the field of environmental health impact in the Faculty of Medicine at the University of Novi Sad and Institute of Public Health of Vojvodina in Serbia. Dr. Dragic's research focuses on the conducting health impact assessment to evaluate the effects of climate change, drinking water, food safety, with special emphasis on air quality. Through her work, she has helped inform decision makers and citizens for action leading to improved air quality and population health. So this is a very illustrative presentation of what is going on in Serbia regarding the monitoring system, but also regarding the projects and activities in health impact assessment. So Dr. Dragic, you have the floor in the next 20 minutes, please.
Thank you. I will share my screen. Well, thank you, Dragan, for nice introductions, and thank you also for the Health Effects Institute for the opportunity as well to be part of some important steps for improving or to deal with one of the leading public health problems, such as air pollution. And I will try to talk a little bit different than always when we talk about data, not in a way how to provide data. And that's why I named this presentation like data as one of the important challenge for air pollution health assessment in Serbia. And in terms of data, I just want to recall some of the information important that we already see until now, that we are exposed to several risk factors that surrounded us through our lifetime, and that nearly 25% of global premature deaths are linked to them. And because that are all the risk factors that surrounded by us, it is called environmental factors. And the most important information here is that air pollution not just leading among all the environmental factors, but it is the leading among all the global health risk factor, and it is positioned on 14 ranking among all health global factors, which means that is almost behind the high systolic blood pressure and behind the tobacco. If we have in mind that tobacco or smoking are as individual choice in terms like I choose to be exposed, while air is a living condition and everyone must be exposed to it, then there are possibility that we have even huge public threat than these data suggested. And also we already know that each year we have nearly 7 million premature deaths linked to air pollution, both outdoor and indoor air pollutions. And the main point here is that all of this quite simple and understandable information relies on the huge amounts of data. And when we talk about data, it is important to know, it is important to know that, first of all, data related to air pollutions. And now we do know that almost everyone exposed to air pollutions. But if we look at this information that we have increasing air pollution exposed regarding the populations, we probably thinking that the air pollutions are problem of air pollution, even worse situation regarding the data in 2016. But it is not just like that simple, because all of these information regarding the air pollution exposure must consist or rely on the several information, not just on the data about air measuring, but also regarding the data of number of population, because we have effects on urbanizations, and also could have to be incorporated the data regarding the spatial distribution due to the regional differences, where in one part of the global we have far more decreasing trend of air pollution, while in the other one, like in China or India, we do have increased population pollution, and this data move or shift the increases in air pollution exposure. Similarly, data behind 7 million deaths or premature deaths comes from the large number of scientific studies which related the mostly respiratory and cardiovascular disease to the air pollution exposure. But the latest scientific evidence also suggests that low birth rate with all negative health consequences, the diabetes, the dementia, as neurodegenerative diseases, also are among the air pollution contributing diseases. And it is important to know that these data show that some of the negative health effects could be expected in any time in life. And if we have in mind all of this information, then the researcher must consider three important factors or three groups of data, such as the type of air pollutants, the absorbed dose, and the individually susceptibility. PM2.5 is the most general indicator because it is not just a unique substance or single substance. It is represent a mixture of organic, inorganic, or biological materials of various size and shapes, and it is also general indicators of combustion source of air pollution, and could have some fraction of natural sources like crustal particulate matters. And on the other hand, health effects depends on the individual absorbed dose, and the data that can describe that individual dose. The dose is like from public health aspect is the ratio of exposure response relationship. And from the public health perspective, because it reveals the possible existence of safe level of pollutions and the magnitude of the health effects to that individual exposure, and the ratio regarding concentration dose relationship is very important to have in mind in every design of the research. And also the health effects of each of individuals, and not just at the population level, depends on the way of breathing, the value of the volume of inhaled air, the presence of some comorbidity or like respiratory or cardiovascular disease, regarding physical activity, years of life, and etc. And all of these data could be or could have to measure regarding some clinical data, individual health indicators. And the time is quite important factor, because health effects is possible throughout the lifetime, and that means that we have to travel with all of these data through time too, as well as the health effects. And when we come to the air pollution data, it is important to know that in Serbia, the automatic air quality monitoring is in real time. We have data from the national network and local networks too, and we can see here that these data are provided from the according to legal basis. And here we can see here that according to this interactive map, we can see the air pollution that must have be monitoring in our country, and we can see according to spatial distribution that we have some special gaps regarding distributions. And that is why even if we have right now the 15 measuring stations, not all of them monitoring all the air quality, air pollution, because several of them, for example, just monitoring the, for example, 24 stations or 38 stations monitoring the PM2.5 data and PM10 data, 19 stations, for example, monitoring the ground level ozons, and we have more stations, for example, 45 stations for the monitoring the SO2 and NO2. But if we choose to use the annual data for example, long-term study, then we can see that we only can reach to data from 33 stations, and that made special distribution gaps even more. The air quality monitoring in Serbia are monitoring through the national network, as I said, and through the local network. But it is important to repeat that even if we have that special distribution, special gaps regarding the national network, we do have, according to law, also additional local network from the local self-government. And here we can see that the special distributions of each of that local self-government monitoring station is pretty much in agreement with the distribution of national monitoring, which means that this is the case of the city of Novi Sad, like additional local network. That means that these two types of level of monitoring have to be good in agreement to cover the temporary availability and also the special distribution in order to get or to reach the exposure response relationship. When you talk about health data, we can extract that kind of data for the health service, because they are a good starting point for monitoring the health status of populations. Because it is conducted as a periodical study for every 40 years, started with the 2000s. And that it is relied on some indicators such as data grouped into several main categories like health status, determinants of health, healthcare, children's health, elder health, and etc. And methodological approach such as face-to-face interview, self-completion of the questionnaire, measurements of some basic anthropometric measures, and etc. Could provide more individual data that we need for the individual susceptibility. But we do have change in some research methodology regarding or between these 4 years. And nevertheless, the most important thing, for example, here, we can see here the type of data, it is in agreement, and it is kind of annual report. And we have here separately, for example, separately 4 cohorts, and they are like open cohort, which means that once when you get the data from any of participants, you finished with them. So you can track the outcome, health outcome as one of the most important variable. But we do have other health data from 3 types of register here, for diabetes, for cancer register, and also for the acute coronary syndrome. And from 2006, it is still in decentralized manner, which improved the data quality. We have a regional register at the level of administrative districts, and they are located at the Institute of Public Health, and they are in charge of keeping that regional registers, while the entire database is updated and analyzed by the Institute of Public Health of Serbia. And it is important to know here regarding the health data that all registers must comprise a minimum of set of a mandatory data like birth of the date, the name, surname, the unique identification number, the gender, place of birth, the residential address, the occupational, the data of the diagnosis, and the type of diagnosis too. And I just want to point it here that it is also contained, but in practice, it is only work with the register for the cancer that they contain the block of the data on the outcome of the disease, like data of death or diagnosis of death. And all of these 3 types of registers, the main roles is to be enabled the calculations of incidence according to gender, according to age, incidence rates over time, and also to calculate the survival rates of the patient with diabetes, cancer, or acute coronary syndrome, and also to be enabled to calculate the years of life lost. But in terms of air pollution, I will say or in terms of air pollution health effects assessment, I would say that these data have to be more comprehensive on an individual level than it is published. But then again, we have, we can extract the health data from the Health Statistical Yearbook of Republic of Serbia, where you have systematically presented the basic data, like you can see here on this slide, and you have here more detailed data where you can extract it. You have population and vital statistical data, communicable disease, and etc. But it is most, let's say, comprehensive health data set in Serbia, but in aggregate level for each year, it could be the problem for some long-term or cohort study. And here I just want to present that the data for the register, but also the data for the annual Health Statistical Yearbook are collected through the network of Public Health Institute and analyzed and reported by the Institute of Public Health of Serbia. But any register that I mentioned here and the Statistical Yearbook, Health Statistical Yearbook, use the data from the Statistical Office of the Republic of Serbia related to the vital statistic and mortality. And I just want pointed here from this slide that the Republic Statistic Office of Serbia it could be as a source of the most accurate data, because you can find here the huge database with the most of the special and temporary available data for that. And the most important, that is the most important for the researcher in order to save the time of every researcher, because it is in adequate electronic format of data set for that data set for use, and we need to keep in mind the time. So if you can see this kind of health data, then maybe the study with the mortality as a health outcome dominate in Serbia when we talk about air pollution health assessment, because the mortality is the routine statistical data and it is easier to achieve that kind of data. And all of this kind of study that you can see here, maybe or the national or local level, could be the indicator for the status of air quality and health data streams. For example, one of the national study provided by the WHO and some of the group of the researcher from Serbia covered the mortality in terms of premature deaths, but it is visible here that they are missing data for the PM2.5 exposure. That's why they use PM10 in converted way. But you can also see here they use the data for the 11 studies for the 11 cities, which means that they also struggle with the special distribution gaps here. And also, we need here from this title of this kind of study that we, beside mortality data or some of the cardiovascular respiratory hospital admission that we use, most of them are short-term time series study. We need more cohort study. So because we need to have data regarding the health risk assessment, because it is crucial to conduct health impact assessment and provide attributable cases of diseases or deaths, because it is the most simplicity and understandable information for the policy decision makers, and also for the general populations. But even if we do not have, let's say, more comprehensive results regarding air pollution health assessment study, we do have a good example how to communicate it with the public or policy decision maker.
Natasha, sorry, just to interrupt you, few minutes to wrap up, please.
Yes, I'm planning to do that. Thank you very much, Dragan. We do have the solutions because we have most of the air quality index that we also use in every part of the world. Some of them are suitable for us to use, some of them are not. But we connect that with the development of the local air quality index based on the real-time data of PM2.5 and PM10 from a low-cost center, and all the data are aggregate on one average concentration in representing the average exposure of the citizens of Novi Sad, and that index related on the based on the national law, WHO guidelines, and most important, related to the several epidemiological study or research in Novi Sad as administrative coffer. And this will be the most conclusion from this kind of presentations. And I will just say that we do have a regulatory framework, but although we need more available data and more spatially covered, especially in the terms of health air pollution data, and more temporarily covered, especially in the health data, because we need more data throughout the time. And we could reach all of these tasks that I put here, harmonized data set from air pollution and from health. But before all of these tasks, it could be the intersectional and knowledge cooperation at first, because we do have exchange, we must have exchange in intersectional level and the knowledge level between any kind or any level of researcher to for the end. I just put this kind of picture because I do believe that in near future we will be able to see the trees among the woods. Thank you.
Thank you very much, Natasha, for keeping the time also. It was also very illustrative information what is going on in Serbia. And obviously you're progressing also in this area. And I am now going to send the floor back to Hanna to introduce our last speaker. Hanna, back to you.
Sure, absolutely. Thank you so much. Thank you so much for this very nice presentation. So let's try again with Katja Giuseppina. Katja, do you hear me?
I can hear excellent. Can everybody hear
super.
me?
So very much
around?
welcome, Katja.
Thank
And
you,
I will quickly introduce you again. You're assistant professor at the Center for Atmospherical Research of the University of Nova Gorica in Slovenia. And your scientific research is in the field of atmospherical chemistry with a focus on the chemical characterization of ambient aerosols. So Katja, please take it away. Very, very happy to have you here.
Thank you very much, Hanna, and I thank everybody for the patience, and I'm really apologizing for technical issues. This was the first for me. So let's hit the ground running. You can see in my first slide, so the name of the campaign that we have done, the Sarajevo Canton Winter Field Campaign. We did it in 2018, and we wanted to have a measurement approach to try to figure out the sources of pollution and give the recommendations for the stakeholders to improve the air quality in Sarajevo and in the entire region. So what you can see in this first photo is the very high pollution episode in Sarajevo, where only the one top of the hills around Sarajevo are visible, and the entire valley of the river and the city is engulfed in smoke. Well, in the next slide, we will show some of our motivation. So we know that about 1 in 8 deaths globally today is due to the air pollution. And for a while now, we know that the number of people losing their lives annually due to the air pollution is about 7 million, as estimated by the World Health Organization in the report in the mid-2010s. So there is a very strong connection between the air pollution and diverse set of ornaments with as humans connected with the heart, with lungs, with cancers. There is also a phenomenon of unequal access to clean air, where the people who are disadvantaged due to their socioeconomical position already, and their societies are also taking the largest burden of the air pollution. And among those people, the fragile parts of society, such as women, children, and elderly, are particularly vulnerable. What I'm showing you here in these two presentations is an illustration of this inequality of air quality. The first figure shows the annual concentration of particulate matter, or PM, fine aerosol, or particulate matter with an aerodynamic diameter smaller than 2.5 micrometers versus the GDP per country. And you can see here that the societies with the lowest GDP are threatened by the highest level of particulate matter in the air. In the second figure, I'm showing you the annual PM10 concentrations correlated to the number of publications on the cities, global cities. And what you can see here that the top 10 most polluted cities about 5 years ago had only about 40 publications about them. So not only that we have highly polluted parts of the world, but they are also understudied. Well, in the next slide, we will now show why do we care about the measurements, and if Renata and Natasha have not motivated you already in their presentation. So the recent World Health Organization report, which came out just now in September 2021, has upgraded the guideline values for the major pollutants for which we know are harmful to the human health. They can be broadly divided into gas and particle phase pollutants. The gas phase pollutants recognized ones are ozone, nitrogen dioxide, and sulfur dioxide. And particle phase pollutants, we speak about PM2.5 or PM10, depending what is measured. Both are regulated. They both have very well documented detrimental effects in human health through the scientific research spanning for decades now. And we can see the particles as very, very potent vehicles to have toxins enter our organism, our deep lung, and for the smallest particles, they can even enter directly the bloodstream. So now in our research, as well as in this presentation, let's focus on the aerosol or particulate matter characterization we did in Bosnia and Herzegovina. Well, Bosnia and Herzegovina is a country in the Western Balkans. It is in the very center of the European Union, and yet due to, maybe next slide, Elaine, thank you. We know, just like the rest of the Western Balkans, Bosnia and Herzegovina is a very mountainous country, and during the winter it undergoes regularly now through the periods of very low air quality in its urban environment. Some recent modeling studies try to quantify this effect of air pollution on the health. Those modeling studies usually use PM2.5 as well as ozone as inputs, and those studies have concluded that in Bosnia and Herzegovina only during the year about 5,000 human lives are lost, and also due to the visits of the hospitals and loss of human lives, there is a tremendous economical burden on the society. So we know that countries, not only Bosnia and Herzegovina, but the countries of the Western Balkans, they go through very high, globally some of the highest levels of ambient air pollution, particularly in the winter season. They're within EU borders, but nevertheless they are understudied. And in the next little highlight, I will show you some campaigns that took place maybe about 10 years ago. Maybe next slide, Elaine. So they noted, so this campaign, Adriax 2004, took place over Northern Adriatic, and the research flights were going from England to the Black Sea. And above the Northern Adriatic, they saw distinctively two different types of air masses, one from East Europe and one from Po Valley or West Europe. And they highlighted the great need for field research and field measurements. So in the next slide, I will show to you. So again, if this is not motivation enough, what I'm showing you here are the real-time online measurements performed by Federal Hydrometeorological Institute of Bosnia and Herzegovina in some of the most polluted urban areas in BiH, and they are the cities of Tuzla, Zenica, and Sarajevo. Here you can see the mass concentration versus the time for the past several years, measurements of PM10 and PM2.5 for Tuzla, because in Tuzla they measure only online PM2.5. I'm also showing you the remote site, Ivan Sedlo online measurements, as a reality check. How does the clean atmosphere look like? So Ivan Sedlo is completely separated from any local emissions. It's on the mountain ridge, and there is no direct indirect emissions. So, and maybe Elaine, next slide, please. So what you can see here, if we now compare it with the most updated values, so different regulatory laws for countries and European Union, they give slightly different values for PM2.5 and PM10. I'm showing here the World Health Organization recommendations, and I'm comparing it with the daily values of PM10 and PM2.5 for all the measurements in Tuzla, Zenica, and Sarajevo. If we compare the yearly measurements of all the daily values we have here, about a quarter and a half for Sarajevo and Zenica, but also about all the measurements, more than 90% of values are above the guideline value in the city of Tuzla, where PM2.5 is measured. So apparently people are living day in, day out in a highly polluted areas. So what did we do in the next slide? So I'm showing you, and maybe one more. So we measured urban atmosphere in the city of Sarajevo at several locations, and we also did the measurements at the remote even settled site. The idea was to see if we have any export of pollution. And in the next slide, I'm showing you all the measurement sites in the city of Sarajevo. And Elaine, you can go one slide further immediately. So in Sarajevo, we measured the 3 places, but at the Otoka, one part of Sarajevo, we have only 1 week worth of samples, and at Ivan Sedlo mountain ridge, we have weekly samples. So majority of my results are really for 2 urban sites called Pofolice and Bjelave in the city of Sarajevo. Again, SAFIC idea was to characterize the aerosol composition, figure out what are the sources of pollution, and try to give science-based recommendations for the improvement of the air quality. And the campaign itself took place in the winter of 17-18. So in the next slide, I will first show you our online measurements. So our online measurements, here you can see the figure which has mass concentration versus time for the whole length of campaign. And the online measurements are extremely good for catching the diurnal variations of pollution. In the urban environment, such as city of Sarajevo, it's important to see how the pollutants are changing throughout the day. Black carbon is the product of incomplete combustion. It is exclusively primarily emitted. It is formed with the same processes we form some of the most toxic species in the particles in the air, such as polycyclic aromatic hydrocarbons. And it's extremely good marker to see how are emissions happening in the place where we are doing the research. The other very important parameter or a set of them are the particle number and sizes, because the more you have the smaller particles, which are normally made in the combustion processes, the bigger are the chances for the interaction of that pollution shed with our organism. So in the next slide, you can see that our number concentrations are extremely high with both instruments that we have had in the field, and they're extremely well correlated with the primary emissions of black carbon. So the instrument with which we measured black carbon, etholometer, is capable of source apportionment in the real time of the black carbon mass to solid and liquid fuels, or biomass burning and fossil fuels. Very broadly speaking, that division is in the part of combustion that is coming from the wood or from the liquid fossil fuels, which would be from the vehicles. If we now look at the diurnal cycle of those of the black carbon as well as its separated fractions, what we see is that overall black carbon peaks in the morning during the morning rush hour, as well as in the evening during the evening rush hour. However, if we now separate it into fractions from solid and liquid fuels, we see that fossil fuels or liquid fuels peak strongly in the morning as expected for the traffic, and there is a smaller peak in the evening, whether the biomass burning or the wood part of the black carbon has a strong peak in the evening as expected when people are coming to be heated. Another thing that we did, which is shown on the next slide, is we collected the daily filter samples at each of our sites. At Ivan Sedlo, we had weekly samples, but at all the others, we collected the daily filter samples. So we have about 3 months at Bjelave and Pohvalići of daily filters. We could determine with that a whole suite of we could do the whole suite of laboratory analysis to determine chemical composition. And we did a bunch of measurements on the larger filter sizes, which we could not do at the smaller filters, which we had at Pohvalići and Otoka. Please note that a number of those species are already measured in the air quality networks worldwide for chemical composition of the air. So what we see in the next slide from the chemical composition measurements is that we have a very high percentage of mass explained, and that is showed in the pie charts in the parentheses. About 90% of our PM10 mass is explained with the measurements we did. What is very important is that vast majority of our mass is organic or composed of organic aerosol and elemental carbon, which are all carbonaceous species. At the next slide, you can also see the breakdown of those carbonaceous species. We were lucky and we were able to do a radiocarbon analysis on the total carbon mass. Radiocarbon analysis analyzes carbon-14 content, and carbon-14 has only 5,000 years lifetime, so it will not be present in any fossil fuels. It will be present only in the modern carbon, such as, for example, wood. And we see that the vast majority of our pollution in Sarajevo or of our carbonaceous mass is coming from non-fossil sources or the wood. In the next slide, I will bring together all the on and offline measurements. So if we average our black carbon to the same timestamp of the filter sampling and compare it with the filter PM10 mass, we see the very high correlation between the two. And the next little animation will show you that our average for black carbon is about 8 micrograms per cubic meter. It's extremely high. I will show you in the comparison. And that about 45% of black carbon is coming from the wood. So in the next presentation, you can see it all quantified, mass concentration versus time. On the upper panel, there are online measurements with super high number concentration of the particles that are very small too. They're below PM2.5. So we have very strong unrestricted combustion processes bringing a lot of pollution to the valley of the city of Sarajevo, and almost all the mass we can explain with the measurements we did. Some trouble that we encountered due to the strong meteorological behavior of the species should be overcome in the next campaigns. Overly measurement should be done for a longer time with daily filter samples or with online instrumentation, ideally both. And then in the next slide, let me now show you how does those, I told you that black carbon values are extremely high, but we don't have anything to compare it with. What I'm showing you here is the comparison of black carbon values for the city of Sarajevo with some European cities. And the urban and urban background, or Pohvalići and Bjelave sites, if we compare measurements with accelerometer from those two sites, we see that the amount of black carbon is about a factor of 2 higher than
Katja, please wrap up. You have a minute or so. Thank you.
Okay. Again, this is the very high troubling point. In the next slide, I'm showing the measurements of polycyclic aromatic hydrocarbons. They are known cancerogens and mutagens, and thus US EPA many decades ago has pronounced 16 pH as priority pollutants. They should be also measured in air quality networks. Our comparison of values in Sarajevo and Zagreb has shown about twice as high cancerogenic potency of measured pH than in Sarajevo. And finally, I will wrap it up with the measurements we did for so-called oxidative potential. It is a new metric for potential toxic effect of particulate matter in the air. I'm comparing here our measurements at even satellite BI level with those in France, Switzerland, and even New Delhi. And the black dots show all the winter measurements, and you can see that the oxidative potential of particles in Sarajevo is higher even than the one for winter in New Delhi. And with the final slide, I would like to thank everybody who has participated in this campaign. It has been a tremendous effort of global scientific community. And with this, I will wrap up. I'm deeply thankful for your time, and I'm apologizing for the issues encountered. Thank you.
Thank you very much, Katja. This was great, very interesting work. Thank you so much. So I'm asking now of all the speakers to open your camera, because we are now transitioning to the Q&A session. And really, for the audience, please put in your questions in the Q&A box. We've received already a couple that is super. And I think I would like to start with a first question to Renata. You know, you gave this great presentation about, you know, all the air pollution modeling efforts you have done in Bulgaria, and all. Thank you so much for that. And we've received sort of a question on I mean, I think I can combine it. I think it would be great if you can elaborate a little bit on the validity of the exposure models. For example, did you do sort of some comparisons with ground measurements? And actually, that was also one of the questions in the Q&A about, you know, is it all satellite data? And also, is there some ground level monitoring data available? So Renata, do you want to comment on that one?
Sure, thank you. I mean, when I presented, I presented all type of data that are available. I mean, in situ ground data, and this data used like for calculating of air quality indexes for the entire Europe. I mean, these data are going, this is official data. They are providing from Bulgarian National Executive Environment Agency. So one of the slides show exactly this official data. They are ground measurements, but the data are very sparse. We have like only 48 stations in the entire Bulgaria area. So this only using this data, it's not enough to conduct some good air quality study. This is why we used mainly, after that in my presentation, I showed different numerical models that we use for this type of studies. And mainly in more details, we can calculate the air quality indices based only on modeling data. Not, I mean, there are two types of data and that you can use to calculate air quality index. One is official that provide for the entire Europe, and another based only on our modeling data from Bulgarian chemical weather forecast systems that provide this air quality index for Sofia, Bulgaria, Balkans, for several different regions. So we do not have too much experience in Bulgaria with health studies, and it was one of the points that I was thinking we are going to discuss later, simply because health data that we have in Bulgaria, they are aggregated to the daily number of patients for big regions like Sofia municipality, and it includes city areas and small villages around. And this type of data cannot represent the spatial heterogeneity of the disease. So we need to address, we need the address of the patients to see the pattern and relate how it's relate selected disease with the outdoor pollution. But you know that this is confidential information. This information is really not available right now in Bulgaria. So in this way, at least I know for one study for Sofia that colleagues used the daily data for patients from emergency rooms, but we are really in the beginning on this type of studies. The second questions related to the plot that I have shown on the second slide, like motivation. This plot is coming from official report of the European Court of the Auditors, and the data that are presented in this plot are from 2012. Now we have really great improvement in air quality in Bulgaria and specifically in Sofia. So if you see from the more recent data from 2021, Sofia is like 81 in this rank between 1,000 cities in Europe. So it is difficult to compare these two graphs because it depends on the methods that was used with this data from 2012 from World Health Organization to get these estimates for premature deaths. And really we need a lot of works in on this area. We have experience with numerical modeling, data collections, but we really don't have much experience with the health studies.
Thank you. Thank you so much, Renata. Let's move to another question. Dragan, do you wanna take it away, the next question? You're muted, Dragan, you're muted.
Sorry, I'm just following the questions, but also some sort of debate which is on the chat, which is very much interesting regarding the connection between this data and between the health science in assessing the health impact. As Renata said, there are differences in methodologies, and I can see that really in this moment there are a lot of data regarding the health impact assessment and attributable that's coming from different centers, and we are a little bit confused when we are debating that during the research events, but also during the projects. And as Natasha mentioned, the air quality RQ Plus software is one of the methods used by the WHO, but there are also some methods coming from European Environmental Agency, then some from World Bank, and there are differences. So this is in regard to this question about the differences in attributable deaths between the countries. So we must be very careful when we are commenting that. I can see that the question came, one is let's say the assessment that classification of air pollution related disease conditions remain a challenge in most developing countries, and Mr. Daku said that the advice and guidance of Natasha is appreciated, but I also think I saw one of the question regarding the PM pollution. I think it is addressed maybe to Katya. To have more data, would it help to supplement the collection of dust samples with optical measurements and their real-time data? whether it is to Katja or to Renata, maybe the both of you can have some comments on this question. Katja? Can you hear me? Can somebody hear me?
Yeah, I hear you, Dragan. I don't think
Katja?
heard you, although she is talking in her phone. You're muted, I think. I see at least, yes. Can you
So
yes,
I
here
believe
you go.
any measurements would help, and optical measurements usually are very efficient in determining the particle size. So yeah, I believe the real measurements would help. My focus, what we try to do is go a step further from only having the PM, let's say PM 2.5 or PM 10 mass information. We wanted to also try to figure out the sources of pollution, with the idea if we understand the sources, then we can make a change and decrease those emissions. So I'm not sure if we can do it with optical measurements. Nevertheless, any real-time data helps.
Thank you, Katja. Here's another question, I think for Natasha or maybe Anko. You know, we've heard that, yes, we really need cohort studies in the region, basically local evidence. And you know, and then looking at your presentation, Natasha, I see many health data sets. It seems like very good quality. There's a lot of registries going on there, accelerating data and all that. And then really the question is, what is it exactly? You know, what is lacking here? What is it? You know, is there this need for additional air pollution measurement? Is it something else? Is it really data availability issues or something else? Can you comment on that a little more, Natasha, and maybe Anko as well? Thank you.
Well, thank you. Thank you for your perspective of this problem in Serbia, for example. Yes, as I mentioned here, and you also repeated that, we have a pretty much huge amount of air pollution data and health data too. And through that kind of data, we can see that we have a hard work of environmental and health professional exist. And however, we do need the capacity building. We do need to harmonize that kind of data, because we measured the air pollution, we measured the health conditions, but these kind of study, or there are a lot of more, but they are not all published publicly. This kind of study just as indicator to us that we do not have health risk assessment and health impact assessments. And for all of that, we do, that's why I said we have to change the knowledges at first. This is the baseline, because every researcher must have in the head any kind of the design of the studies. And we have to, I like to say we need to play it with the data. If we want that at first, we need to have a good accessibility to that kind of data. You know, each kind of data that I represented here are almost at the level of one number. And if you have a huge amount of clinical data and they are reported to public at the one number, like number of diagnoses, not the number of persons, which you can track throughout the time, which is more important to the stretching the exposure relationship, exposure response relationship, then we have a problem. That's why I said, as one of the most important maybe conclusions, that we do need the harmonized data sets that we have, in a way that we can use that as a resource for the health risk and for the health impact assessment. Because if we want to talk about the air pollution as a problem in our country or our region, even if we have the available air data, air measurements, we do not, when we communicate with the policy or with the general population, we have to explicit that or explain that in some nice and simple information, and everyone understand the number of deaths. So through that kind of information, through that kind, even if it is also one number, through that kind of information, we can see, do we have problems? Because from public health aspects, any one parameter that could be the problem, even if you know that this is the risk factor that we could manage in a good way. We do have solution for that, but we also, any part who has the solutions are also the part of the pollutions. So that's why we do have to start it with the individual changes of lifestyle, and then we started with providing more and more data, and then I think that it will be, but that knowledge is the baseline, because only according to that kind of information we can start to manage good with all of these kind of data.
Yeah, thank you so much, Natasha. Angel, do you wanna add something to this?
Yeah, I think that this is an important layer to add to the discussion. So the accessibility of the data, and by accessibility, I mean this in a more generic sense in terms of comprehension of the type of data that we need and the background of researchers that handle those data. Sometimes we have a missing piece there. So the health scientists, at least in Bulgaria, I assume that this may be an issue in Serbia, another country, have a rather crude understanding of all the modeling issues and the usefulness of model data. Usually what you would see is a public health scientist simply reaching out to the regional branch of the Environment Agency and obtaining the data from the monitoring stations, which would allow only for assessing, say, temporal dynamics of air pollution and relating that to aggregated data on health effects. I see that this is also an issue in Serbia, or contrasting very large spatial areas where you simply miss the fine contrast between closely located residential addresses, which is another issue, since those population-based surveys that we also have in Bulgaria, like the European Health Interview Survey, European Quality of Life Survey, they do have the self-reported health outcomes, but no way to link those to a specific residential address, to geocode people's residences. And in this sense, I think that it is not just mortality that we should be interested in with those. Even if we disaggregate the data from health registries, it will be still very crude. It will lack information on confounders, on effect modifiers, and that will simply not allow us to look at kind of adjusted effects of air pollution, to parcel out all the variance in health that is contributed by other factors. And this is a major hindrance to moving things forward in our area. So that study that Renata mentioned, like on the European scale, it may be perceived as suboptimal in design, as it will be only a cross-sectional study, but for Bulgaria, this would be a huge leap forward, as the sample will be population-based. With 1,000 individuals, well, that would allow for stratification of effects. Usually, 1,000 individuals are considered representative of the whole country. And in this case, we'll sample them from a single city. We'll be able to account for individual level factors for lifestyle, other environmental co-exposure, duration of residence at the address. So this would kind of allow us to specifically isolate the effect of air pollution and look at not just mortality on, say, day-by-day basis or annual mortality, but also on chronic effects and non-communicable diseases. So on morbidity and prevalence of disease, which I think is also valuable to investigate.
Absolutely. Thank you, Anko. Very, very useful insights. I'm looking at the time. We're running out of time here, unfortunately. Dragan, do you wanna, is there a short other question, or do we want to wrap up? You're muted.
Yeah. Maybe we can consult Elaine, because if we are about to close the event, then we can comment something as a closing remarks. I don't see any other questions. I can see some assessment of the presentation of Katja. I'm very much sorry that Katja did not have a proper time to present it, because I see it as a very, very attractive when we are discussing about a relatively new issue of the oxidative potential of the PM particles. So far, we are just estimating the number and maybe the forms and the sizes, but not the potential. And we can see that even in that area, we are on a very worst level in the region. We have a very high level of concentration, but also high level of oxidative capacity, of harmful capacity of the PM. And maybe the question will be how this can be used in the health assessment process, because so far, as Angel mentioned, we are just calculating, estimating. I agree, it is not maybe the right scientifically way, but at this moment, Angel, I think it is useful for us just to present the case to the political people. It is an estimation, it is not maybe highly accurate, but it is something which is based upon international references. So I agree also that we should progress in more accurate way and go more in depth among the population, see the confounding factors. So I think that there are a lot of open questions, but I see this event that it also offers some of the solutions in dealing with the air quality management. So I don't see any particular question, but I think it is my perspective of what we were doing today. Back to you, Hanna.
Sure, absolutely. This was very helpful, Dragan. Yeah, I mean, I think the only thing I wanted to say is really thank you all very much, and really I would like to mention again that both HEI and ISEE-Europe, they recognize the importance of foster environmental health research in this region, and we're very committed to do so. So this was only a start at this webinar. We're planning other events. So please stay in touch and please reach out. And I'll give the floor back to Eliane or Pallavi. Thank you so much, all.
Thank you all. Yes, and on behalf of HEI and ISEE-Europe, I want to sincerely thank all of our speakers for sharing their important research experiences, and to the co-chairs for leading an excellent discussion. Unfortunately, we ran out of time, but I also want to thank all the attendees for sharing your time with us today. All the slides and webinar recordings will be available on our website soon, so please check back. And before we end this webinar, I want to thank a few people. Without their help, we wouldn't have been able to have this webinar. From ISEE-Europe chapter, Peter Jungman, Arthur Badida, Tamara Tchaikovsky, Zorana Anderson, and Hanna Boogaard, and also Angel Zambov, our technical collaborator at the Medical University of Plovdiv in Bulgaria, and Michal Krajsanowski at Imperial College, who also serves on HEI's Global Health Oversight Committee. And from HEI, none of this would be possible without Pallavi Pant, a senior scientist and Global Health Program lead. And thanks so much to Robert Shavers, who managed today's event, and to our communications team. We really hope that you will join us in February for our third webinar in this series, in which we'll discuss how the regional evidence on health effects of air pollution and the various air quality and health data streams can inform air quality policies on a regional, national, and local level. So thank you all very much. And until then, we wish you the very best for the holiday season. Thank you.